Cancer immunotherapy is a global term, and it really encompasses very different types of treatments for cancer patients. Some of these immunotherapies include antibodies, some include vaccines, some include cytokines, and some include checkpoint inhibitors. Antibodies are considered active forms of immunotherapy. They're given to patients mostly through IVs, and these medicines, and specifically this antibody, is targeted to a particular molecule that sits on the surface of a cancer cell. So this antibody recognizes this protein or molecule, and it binds to the cell, and then it triggers the body's immune system to then essentially kill the cell with the immune system. So vaccines are another type of immunotherapy that we use to treat cancer. In particular, it's used pretty much to try to prevent cancer from recurring. So when patients who have had cancer and have been effectively treated with either surgery, radiation, and/or chemotherapy, the goal is to prevent the cancer from coming back. And so vaccines are injected into patients just like we would administer any other types of vaccines for, like, the flu, measles, mumps, rubella, polio, things of that nature. So components of a particular cancer, whether it's from a cancer cell, a cancer antigen, are injected into patients with the thought that the patient's immune system will develop antibodies against seeing these substances, so that if they ever return, the immune system gets started and acts against these cancer cells and say, hey, this is a bad thing, let me kill the cancer cells. So cytokines are another type of immunotherapy that are used, and these are substances that are naturally produced by the body in order to activate a patient's immune system. So these are produced in normal times when patients get the cold, get a flu, and get vaccines to rev up the body's immune system to attack the foreign agent. And so sometimes they're used to, again, rev up a body's immune system to attack the cancer cells. Generally, it's been used in adjuvant therapy, so again, in ways to try to prevent tumors from coming back or prevent the cancers from coming back. And certainly one cytokine, particularly IL-2, has been used for treatment of kidney cancer and for treatment of melanoma prior to the advent of the checkpoint inhibitors. So checkpoint inhibitors are the newest members of immunotherapy for cancer treatment, and these are novel in the sense that they take the brakes off the body's immune system. Inadvertent activation or sustained activation of the immune system is sort of how patients develop autoimmune disorders. So the body wants a way to shut it off. And the way it does that is throughout the different parts of the T cells, specifically of the immune system. There's a number of stop signs that get used to turn the immune system off. And so checkpoint inhibitors actually block these stop signs, so essentially rev up the body's immune system to keep going and going to fight and attack cancer cells.